concept is that it increases access to care. When we move on to the next slide, for acute, for folks who are sick, have developed a fever overnight, and they want to be seen. Yes, we have an ER, but that's not an emergency. What we want is we want you to come to medical home port, and we'll get you in that day. For most routine appointments, we'll attempt to get you in that day, but if not, we're going to get you in that week. The ER, as I spoke of before, is open 24/7, 365, but it's for emergencies only. During working hours, if you present to us and you have something that's truly not a medical emergency, perhaps it's a sinus infection, something of that nature, we're going to take you over to medical home port and get you engaged with your medical home port team to make sure that we have that continuum of care provided for you. One of the questions that has come up from the FRGs and the Ombudsman is, what do I do if I have an accident out in town? What if I'm traveling and I have an accident? Lieutenant Davila is going to talk about this a little bit later. But you go to the nearest emergency room just like you would here in town. TRICARE does provide for emergency care while you're traveling, emergency care for anything, whether you're in Puerto and you go to the local hospital there, or if you're in Madrid on vacation. So we use one of the primary means that we communicate with dependents, with family members, is through Relay Health. Basically, it is an online portal that allows you to communicate directly with your primary care. So whether or not you want to schedule an appointment, ask a question, request a refill on a prescription, you'll be able to do that through Relay Health as opposed to coming into the hospital. Also, TRICARE Online is a web-based system that allows you to look at your medical record now. Both Relay Health and TRICARE Online are services that you can register for now and that you can utilize now through your healthcare providers here in Virginia. Our nurse advice line is available to you if you have any questions, 24/7, to give them a call, and they can help you out with any acute medical questions that you may have. So I spoke briefly about our reliance on the TRICARE network to provide care. So we may, depending on what you present to us with, we may refer you to care in the Spanish medical system. So what we do, our referrals office will make sure that you get the right doctor, that we get an authorization for you from TRICARE, and then we'll help you schedule the appointment. If you do not speak Spanish, we will provide you with translation services to go to that appointment. That's active duty, you can rely on that. For dependents, for family members, if you are enrolled in TRICARE Prime, we will provide that translation service to go with you as well. So some of the things that we rely on the network for, just so you can have an idea, MRI. We do normal x-rays, we do CTs at the hospital, but if you require an MRI, you're going to go out into town. ENT, ophthalmology, cardiology, those are all specialties that we rely on the Spanish medical system for, as well as intensive care, cardiac care, NICU, and high-risk OB. Naval Hospital Rota has no critical care services, but we have long-standing partnerships with local Spanish facilities to help, cases that fall into high-risk pregnancy, NICU, and critical care. Elective surgeries, I just want to touch on briefly. All elective surgeries in town require pre-authorization and pre-approval from Naval Hospital Bremerton. I share that again, expectation management. A lot of the Spanish medical facilities may require payment for procedures at the time of service or up front. So it's a little bit different here where you can go to a doctor's office and then it goes to TRICARE and then you receive a bill several months later. Here you could potentially be paying for something up front or at the time of service. So it's important that you work with the hospital, you work with primary care to get referrals and pre-authorizations and approvals for any type of surgery that you would get done out in town. That includes elective procedures. Another question that has come up from the ombudsmans and the FRGs are for dependents that were on a waiting list here for LASIK. You need to get that procedure done here in the States. That service is not available for dependents and family members over in Europe. For active duty that are currently eligible, when you move over to Spain and you meet the clinical criteria, you may go to launch school to have that procedure done. It is an elective procedure and there may be a cost incurred. But for active duty that we're looking to explore LASIK, it is a possibility in Spain. For family members, though, you do want to pursue that while you are here in the States. All right, so when you arrive in Spain, we've got to get you enrolled. So what do you need to do? So again, we're throwing a lot of information out at you. This will be touched on again in the ICR class. You might have heard that several times today. They'll remind you of this when you arrive in Spain. But basically, you'll visit the TRICARE office. You'll complete your enrollment, provide us with a copy of your command sponsorship letter. All beneficiaries who are going to receive care at the hospital, so your family members and your dependents that are enrolled in TRICARE Prime, need to stop by our medical records department so that we can begin the process of getting your medical records on site if they do not hand carry them with them. Lieutenant Dowell is going to talk about the TRICARE programs available, and then I'll be back in a minute.
All right, let's talk a little bit about TRICARE. Okay, so all active duty service members are required to be in Prime. You don't have an option. Prime is awesome though, because there are no deductibles, there are no costs. For family members, you have an option to go either standard or Prime, and I'm going to tell you the difference in just a minute. Okay, I know when I went to Rota for the first time, I had asked myself, what happens when I travel to Rome or Paris? Where do I go? Can I get emergency care? Yes, you can. You do not have to have pre-authorization. If you have an emergency need, make sure you call 911, tell anyone, make sure you get to the emergency room as soon as possible. You do not have to have pre-authorization, okay? If you need something like urgent care, like you have a sore throat or maybe you sprained your ankle, you are going to have to get pre-authorization. You're going to have to call ISOS, International SOS. Make sure you take this number with you every time you travel. You're going to want to take this number with you, okay? Don't forget it. We have these little passports out there on our booth, and you're able to take them with you if you like. And again, like Lieutenant Lee said, you will get this brief again in ICR. Once you get to Rota, they're going to offer those passports for you as well. Okay, this is the difference. So this is TRICARE Prime. As it says, there are no enrollment fees or no deductibles, which is awesome. So if you're a family member, it's up to you whether you choose standard or Prime. I would recommend you choose Prime because you can get all your care at the MTF. There are no costs. The only time you're going to incur costs is possibly if there's medications that are not there at the hospital, which for the majority we have all the medications. Or if you decide that you want to go out in the network and you do not receive a referral, then you also may incur some costs. For standard, the benefit of standard is that you don't have to have a referral. You can go out in town, you do not need a referral. There are costs, there's cost shares. If any of your standard now, you know, I think it's approximately 15-20% depending on the situation. The overseas dental. Okay, so for all of you, for active duty service members and family members, you are not required to have a MetLife dental plan. If you choose to keep it, it would benefit you because whenever you do travel to Rome or to Paris, you don't have to worry about paying out-of-pocket costs if you have an emergency dental need. So it might be behoove you if you go ahead and keep that, but you don't have to. Again, that's up to you. Now let's talk a little bit about overseas suitably screened. So, like Chief Dugala said, you do not have to wait until you receive orders at this time because we understand you're not going to get your orders until later. Go ahead and get it done now. All right, start the process now. Something very important too, SHIP IDCs cannot screen family members. You have to go to your nearest clinic, whether you're assigned to Sewell's Point or assigned to Boone Clinic or assigned to Naval Portsmouth Center Hospital, then you'll need to go there. Something also to keep in mind, like Lieutenant Lee said, touched on, we have no inpatient mental health, so make sure you fill out the forms completely. There's 2 forms you're going to have to complete. 2807 and a 1300/1. It's going to ask you questions. Have you ever been in an emergency room? Have you ever been admitted in a hospital? Very important information. Make sure that you specify. There are very specific questions that require specific answers. Your provider is going to look at your history, and they are also going to document information on those. EFMP, what is the EFMP? EFMP program is designed to identify any dependent that may have some type of specialized medical or educational need, and they want to ensure that you get to a place where those medical needs can be provided. It's not a bad program. I know people think that, oh, I don't want to be EFMP enrolled, and then we have other members that say we want to be EFMP enrolled. Your providers are not the ones that choose whether you're going to be enrolled or not. They're going to complete the paperwork for you. It's going to go up to a central screening committee.